Welcome to the only patient advocate podcast you'll ever need. In this podcast, you'll learn how to advocate for yourself and your family, and where to turn when if that becomes overwhelming. Now, here's your host, Joyce Schulz-Killian, registered nurse and owner of At Your Request Patient Advocate, LLC. She is your private patient advocate. Here at your request to communicate, educate, and advocate with and for you.
Hello, everyone. Hi, I'm Joyce Schulz-Killian, a registered nurse for 27 years and in healthcare since I was 18 years old. I am the owner of At Your Request Patient Advocate, LLC, and I'm here at your request because I am your private patient advocate, helping you navigate healthcare one puzzle piece at a time by educating, advocating, and communicating with and for you. I'm hoping to give you the tools you need to be your own best private advocate. You can find me on Facebook at Your Request Patient Advocate and on Instagram at JSKICURN and on Twitter at RN Advocate, the number 4 and the letter U. So RN Advocate for you. Hit like and subscribe if you like what you hear, and tell a friend. Today's podcast is called Christine. And it's going to be about, I'm going to do a clinical on one of my patients. Christine is not her name. Names have been changed to protect people. But I do have her permission to talk about this. And it's a very important podcast. So we've all been in a doctor's office, a dental office, and they put some papers in front of you and they ask you to sign them. They're consents for treatment. One of the papers says, and I'm going to read to you, I understand that if I choose to have my insurance billed, it is my responsibility to ensure that the rendered service is covered by my insurance carrier. I understand that it is possible my insurance will not pay for the services. Reasons which insurance companies give for not paying for services may include, but are not necessarily limited to, non-coverage, medical necessity, no authorization, services that are deemed experimental, and otherwise based on the limits of the agreement between the insured and the insurance company. I understand that if my insurance company refuses to pay for the services, regardless of the reason my insurance company gives for the refusal, I will be held responsible for all of these payments of these services. End quote. Have you ever seen this statement when you were at the doctor or dentist's office? Have you signed this statement on their general consent and agreement to pay for treatment? It has many more implications than you could ever imagine. Did you know you can't call in your own pre-authorization? Are you counting on the doctor office to do it? Well, what if they don't? You're responsible for their errors. It says it right there. No authorization. What about the wrong authorization? The office girl calls in the wrong code. Is she responsible or are you? Well, you are. Did you know you can also cross things out and refuse to sign? Add to this statement if you choose, because they will throw you under the bus in a second when it comes to their big business profit or one patient. Who do you think they will choose? What is a prior authorization? Prior authorization is defined as, referred to as pre-authorization, is a requirement from your health insurance company that your doctor obtain approval from your plan before it will cover the costs of a specific medication, medical device, procedure, or treatment. Many times this involves your doctor completing a form to illustrate to your insurance company why the treatment or the procedure is necessary. Your insurance company will have requirements that need to be met before it will agree to cover the specific item or treatment. Why are pre-authorizations important to understand? It's helpful to understand the steps that you need to take to gain access to your coverage for prescriptions, treatments, surgical options that you use to manage your health. Each plan is different. So while one insurance company plan may not require a pre-authorization for your treatment or surgery, another plan, even one from the same insurance company, may require that. You have to check with your insurance plan policy documents before starting the process to understand if a pre-authorization is required. Also, the exact content of the pre-authorization may vary from point to point. Some pre-authorizations may only require a doctor office call. Others may require paperwork, test results, or other documentation to support the authorization. Make sure you understand what is required from your insurance company. I'm going to read this statement throughout this podcast because it is so important. I understand that if I choose to have my insurance billed, it is my responsibility to ensure that the rendered service is covered by my insurance carrier. I understand that it is possible my insurance will not pay for the services. Reasons which insurance companies give for not paying for services may include, but are not necessarily limited to, non-coverage, medical necessity, no authorization, services that are deemed experimental, and otherwise based on the limits of the agreement between the insured and the insurance company. I understand that if my insurance company refuses to pay for the services, regardless of the reason my insurance company gives for that refusal, I will be responsible for payment of these services. Enter my second client ever. Circa end of 2015, we're going to call her Christine. Christine found me through a web search for an advocate after speaking to a few other advocates who stated they could not or would not be able to help her, she called me. As Christine told me her story, my mouth opened and didn't close for a while. She had been treated by a nephrologist, a kidney doctor, for about 6 months. Testing and workups, and she would require a kidney surgery, a nephrectomy, in September. Nephrectomy is a minimally invasive surgical procedure to remove a patient's kidney. It's a pretty large surgery, but the surgery is minimal. It's very large for the person because they're left with one kidney. But it is pretty routine. As you know, people donate kidneys all the time to other people. You can live with just one kidney. So this was a condition that I believe she had from when she was a child, and she knew at some point she would possibly have to have more surgeries. It was going to be done laparoscopically, which means minimal invasion, only 3 puncture wounds or very small incisions, no big, large main incision across her abdomen or her back. Again, it was supposed to be a routine, simple procedure. The doctor never discussed the use of any other equipment and expressed simple procedure in all their visits. The doctor's pre-authorization coordinator called in the code to the insurance company for pre-authorization. Christine had her surgery in September of 2015. It was a success. She healed well following the surgery and had no complications except for one. She was charged $9,000 on her bill that was not covered by her insurance company. What? Yes, again, I understand that if I choose to have my insurance billed, it is my responsibility to ensure that the rendered service is covered by my insurance carrier. I understand that it is possible my insurance will not pay for the services. Reasons for which insurance companies give for not paying may include, but are not necessarily limited to, non-coverage, medical necessity, no authorization, services that are deemed experimental. ... End of quotes. And here we stand. The reason I knew I was supposed to help Christine was for 3 things. When she sent over the documentation for her surgery and some other forms that I had her fill out, her birthday was exactly 1 year before mine. Same date, just 1 year earlier. So she was 1 year younger than me. Her surgery date was my son's birthday, but in 2015. And the third reason that I knew I was supposed to help Christine was because her story compelled me. How could this happen? How could this happen to somebody? Here she had been going to this doctor for 6 months, been in contact with him, had no problems with her insurance paying for any of her treatments or visits or tests that he had ordered. So how did she think that this would happen? I agreed to help her and only charge her if I was able to get back any of her money. I would charge her 10% of whatever I recovered for her. So I worked with Christine for almost a year. I started to gather information. Christine had lots of documents, reports, and paperwork to sort through. I also began calling the doctor's office, the insurance company, the hospital billing department, the utilization review committee, and the list goes on. During my investigation, much was discovered, and it came down to this. The pre-authorization coordinator, her only job in the office, verified she called in the pre-authorization. It was documented in the patient chart with her name, except the pre-authorization coordinator used the CPT code for a nephrectomy to authorize the procedure, not a laparoscopic procedure of the kidney, and nor did she ever mention the use of a robotic device or coded for the use of a robotic device, which I find out there are separate codes for robotic procedures. Had she mentioned the word robotic in any of her discussion with the insurance company, the insurance coordinator on the phone for authorization at the insurance company would have told her they do not authorize the use of any robotic equipment for simple procedures like this one. Funny thing is, this doctor doesn't do this simple procedure without the use of a robotic device, since one has become available at the hospital surgical suite. It was not good news. But this is easy, right? The coordinator charted, she called in the wrong code, so they will admit their error and pay, right? Hell no. And so the year-long battle ensues. I became an investigator, when that didn't work, a detective and a crime specialist. Needless to say, the doctor was not accepting his responsibility or that of his practice, and the pre-authorization coordinator who called in the pre-authorization was not admitting any guilt or accepting any responsibility either. Detective Joyce began figuring out emails for the practice based on one email I had. I thought emailing all of the practice to let them know that this one patient of all their patients that was billed this exorbitant amount of money for the use of a robotic device that is now impacting her financially in a large way. $9,000 is nothing to sneeze at. Their reputation is at stake as I saw it. I thought they'll agree to pay for this. They'll agree to call the hospital, talk to them about maybe possibly having the robotic, cost removed from the bill. The doctor was not having any part of it, and the rest of his practice didn't seem to care either. I got no answer from anybody. How sad. I even emailed their board members. You can find a lot of information out on the web. How sad. I was taking a step-by-step approach to getting this reversed. I spent time on the phone with the hospital billing department, the surgical department, to find out how often this MD uses this robotic device. Every time. I found every organization that could possibly help us, like the local commerce where the practice was, the Department of Health and Human Services, the Office of Inspector General, the Better Business Bureau, the improvement areas of the insurance companies. We left poor reviews warning people of the deceptive practices on Google. I even made a claim to the medical board in his licensing state, stating the facts and asking that they intervene. I never heard back. We even went to the local news, kind of like our Channel 5 investigation team in Chicago, which I did reach out to, but because this was not in our state, they could not help me. Our team in Chicago, the Channel 5 investigation team in Chicago, has helped people get over $3 million back in compensation from disputed claims. But this was a smaller station that they guided me to, and they wouldn't help air the story. They stated it wouldn't be beneficial to their ratings, and they didn't think that they could make a difference. What? I assumed they were protecting the large practice in this smaller town. After a year of expending all of our options to get the money taken off the bill, Christine decided to start making payments as she did not want her credit to be affected. I felt defeated. My heart went out to Christine and her family. What a huge burden. I think of Christine on her birthday and have sent her cards since then, but we don't talk or communicate. But I still feel a connection to her. I can't believe we didn't win any part of this being taken off the bill. Again, I understand that if I choose to have my insurance billed, it is my responsibility to ensure that the rendered service is covered by my insurance carrier. I understand that it is possible my insurance will not pay for the services. Reasons which insurance companies give for not paying for services may include, but are not necessarily limited to, non-coverage, medical necessity, no authorization, services that are deemed experimental, and otherwise based on the limits of the agreement between the insurance and the insurance company. I understand that if my insurance company refuses to pay for the service, regardless of the reason for my insurance company gives for the refusal, I will be responsible for the payment of these services. No, you cannot call in your own pre-authorization, but you can follow up and make sure the procedure, surgery or treatment, etc., was called in correctly. You can talk to the insurance company about what the doctor's office called in. The doctor mentioned to Christine he may use a robotic device if it was available, but she had no idea it would affect her life so much. Ask all the questions. Christine never followed up with her insurance company. She didn't feel the need. She was going to this doctor for 6 months. This procedure there were tests that would lead up to this surgery that the insurance company never questioned. She never, ever thought there would be a problem. Call and follow up with your insurance. You cannot pre-authorize your own procedure, but you can follow up and make sure, to the best of your ability, that whoever did from the concerning medical office call it in correctly and ask all the right questions regarding your coverage. And if you are at all concerned, call an advocate to help you before the procedure. Here it is one more time. I understand that if I choose to have my insurance billed, it is my responsibility to ensure that the rendered service is covered by my insurance carrier. I understand that it is possible my insurance will not pay for services. Reasons which insurance companies give for not paying for services may include, but are not necessarily limited to, non-coverage, medical necessity, no authorization, and services that are deemed experimental, and otherwise based on the limits of the agreement between the insured and the insurance company. I understand that if my insurance company refuses to pay for the services, regardless of the reason my insurance company gives for that refusal, I will be responsible for payment of these services. I would encourage you to think about that the next time you go into your doctor's office and they hand you those papers, whether it's a doctor or a dental office. We just always sign because we trust them. We always just think that they've got it covered and everything is going to be okay. And when they say they're going to call something in, we think they're going to do it the right way. Why wouldn't they? That's their only job. But people do make mistakes, and the only one that's going to protect you is you, or a patient advocate. So, on that note, I would like to thank you for listening. And if you like what you hear, please hit like and subscribe and tell your friends. I would like to thank everyone who helped me take the plunge into this podcast and with all my dreams I've had in the past 8 years. Remember, I am your private patient advocate, and I'm here at your request to help you navigate the healthcare system, one puzzle piece at a time, by educating, advocating, and communicating with and for you. I'm here at your request because I am your private patient advocate. Find me on Facebook at Your Request Patient Advocate, on Instagram at JSKICURN, at Twitter at RN Advocate, the number 4, the letter U, so RN Advocate for you. Hit like and subscribe and tell a friend.